Taiwan currently holds a troubling medical record. It has the highest cancer incidence rate in all of Asia. To understand why, researchers at a local hospital began analyzing patient blood work, looking for physiological markers that might explain the surge. This data visualization shows the primary correlation they discovered. While normal vitamin B12 levels are relatively low, patients with blood concentrations exceeding 2,000 picograms per milliliter showed a 3 times higher risk of developing cancer within a single year. Laboratory records traced these high B12 concentrations directly back to the habitual use of over-the-counter supplements. These findings suggest a direct conflict between the common pursuit of wellness through daily vitamins and the prevalence of the region's most lethal disease. This behavior is part of a broader cultural habit. As we can see from the density of supplement bottles on these shelves, B vitamins are frequently marketed as a universal solution for everything from general fatigue to brain fog. This market is driven by a specific biological assumption that B vitamins are entirely water-soluble. Most people believe that the body simply filters out any excess nutrients and flushes them away in urine, making the supplements effectively harmless. But if the body is supposedly washing the excess away, we have to ask why these nutrients are lingering long enough to correlate with a spike in cancer rates. Vitamin B12 serves as the primary regulator for the B vitamin group, responsible for 2 critical biological tasks: managing cellular energy and overseeing DNA replication. This becomes a problem when we look at cancer cells. They serve no functional purpose. Their only objective is rapid and aggressive multiplication. To sustain that rate of growth, cancer cells require a constant supply of raw materials and energy for continuous DNA replication. This model illustrates the interaction. High-potency B12 provides direct metabolic funding to rogue cells, accelerating their replication. Importantly, B12 doesn't create the cancer itself. Instead, it acts as a powerful fuel source for precancerous cells already present. Taking these vitamins for an energy boost can unintentionally provide the energy needed to turbocharge a tumor's growth cycle. This biological reality contradicts the idea that all B vitamins are easily discarded. Unlike B1 or B2, the body treats B12 as a resource worth protecting. The liver uses an internal inventory system where proteins bind to B12 for long-term storage. Synthetic supplements can quickly push this reservoir into an overloaded state. Just 100 days of high-dose supplementation maxes out storage capacity, keeping levels elevated for years. Comprehensive data from the UK supports this, showing a 4.7 times increased risk of cancer in individuals with these elevated B12 levels. Other vitamins carry similar risks. For instance, high doses of vitamin B6 are a known cause of peripheral nerve damage. Overstocking the body's biological inventory can transform a helpful nutrient into a catalyst for a toxic internal environment. Moving forward requires a shift away from the more is better approach to supplementation. The only safe way to manage vitamin intake is through clinical testing. By checking your blood first, you can limit your intake to only the specific nutrients your body actually lacks. Doctors recommend testing these 5 specific baselines. This includes vitamin D3 for muscle and immune function, and zinc for skin health and immunity. You should also monitor iron and ferritin to prevent restless leg symptoms and support dopamine production, alongside folic acid for essential cellular maintenance. Finally, check your B12 levels to ensure this DNA regulator remains within a safe, balanced range. Achieving health requires replacing the guesswork of over-the-counter pills with a strategy of targeted testing to address your body's actual requirements.